able to see the screen, guys? It says business of medicine. Yeah. Okay. Okay, guys. So let's start the session for today. All right. So probably you had many questions about what is coding and how exactly coding is done, right? So let us start with some questions first, and then I'll take you through the topics. Okay. So do you have any questions? Like you want to know what is coding? Can I start with that? Can I start with that? Okay. So medical coding is a process in which we are going to go through a lot of medical records, okay, and we are going to convert all those medical record data into alphanumeric codes based on the system that is given to us by the American Medical Association. Right? So that is basically a gist of what a medical coder does. So we are translators. We take all this information, data from the records, and we convert it into alphanumeric code systems. Right? So that's what we do as medical coders. That's a small thing, small gist of what we do. Right? So let me take you through the process, right? Business of medicine. So I hope you guys can see the screen. Can you all see the screen that I've shared with you? Yeah, is it visible? Being as a profession? Yeah. Is that visible to all of you? Okay. So the coder plays a very important role in the proper reimbursement and livelihood of the yeah. So livelihood of the providers. So let me first make you understand what is a provider, what is the patient.
So, excuse me, ma'am, there is so much disturbance behind.
Yeah, that is because the participants are switching on their mic. So may I request all the participants can please, mute yourselves. May I request all the participants to please mute yourselves so that my voice is audible to all of you? Yeah. Thank you, guys. Thank you so much, my people. So now am I audible to all of you? Are you able to hear me? Clear?
Yes, ma'am.
Okay. So first, let me make you understand what is the patient, what is the provider, and what is the payer. So once you get to know these three things, then you'll get a better picture. Okay. So a provider is basically a doctor, right? Whoever is going to treat the patient, he is a doctor, whether he's an MD or a DO, whether he is a radiologist, pathologist, right? Whoever it can be, provider is a blanket term to use to describe anybody who provides medical care, who is certified for producing or giving medical care. We call them as providers. Okay. And patient, a person who receives medical care, we call them as a patient. Yeah. Then payer is the insurance company. Okay. So let me help you figure out how healthcare works in India versus how healthcare works in US. Okay. So once you understand the difference, you get again a clearer picture of what we do. Okay. So in India, most of us are not usually covered under health insurance. Even if we are covered under health insurance, what happens is that you need to get admitted to avail that insurance, right? Outpatient, we don't cover much in India, right? But in US, that is not the case. In America, almost everyone, even including children, they are all covered under some form of insurance. Okay. So why is it that case? Is that so the level of care, the cost of care, right, in US is way too high. All the processes are very costly over there compared to that of India. Okay. So there almost every person is covered under some form of insurance. Either it can be government insurance or it can be private insurance, right? Some form of insurance, they would have covered that patient. So what will the patient be doing all his life or her life? They will be paying some amount as premium for the insurance company. And that is where the payer comes into picture. So payer means insurance company. So now we learn three P's. So one is the provider, who is the physician or the doctor or anybody who gives medical care. We call them as providers. Then we have the patient who receives medical care. And the third P we are talking about here is the payer, who is the insurance company. Okay. So how the cycle happens between these three people and where do medical coders come into picture is what we will try to learn during this demo session. Okay. So now when you have a encounter, which is a medical encounter in US, right? Compared to India. So here what we are going to do, if you are not feeling well, the max you will do is call your doctor once, right? So he will ask you to come in, walk in, right? Probably without an appointment, right? He will just ask you to come. So you will go to the clinic. If it's an outpatient visit, you will just pay him then and there, right? He will give you 1 page of document maximum, which is your prescription, right? So he will write your vital signs. He'll write the reason for encounter. Why did you come? What was your chief complaint and all that. And then finally, he'll write all the drugs that you're supposed to take, and this is your diagnosis. Right? He will write it everything in a single page, one document, and he'll share it back with you. Right? And also, you are going to pay him then and then. So the cycle ends here in India. It gets over. So the provider is getting paid on the same day. Right? So that is what happens in India. But in US, that is not the case because the care level of cost is extremely high in US. Their process is entirely different from our process. Okay, so this what you're going to get into is an international process. Okay, it is a US process. It's a knowledge process outsourced. Right? So there, what happens in US is even if it is a small outpatient encounter, also there are many records that will be generated. Right? So there, when you take an appointment with the provider in US, you will have a encounter that is happening between yourself and the provider. And there, every time you have an encounter, a medical record is getting generated. We call that as electronic medical record, electronic data. Okay. So then what happens after the encounter, the physician is going to diagnose you with something, right? So if, for example, if you have symptoms like polyuria and polydipsia, which are excessive thirst and excessive urination, right? So then physician is going to order some tests for you. It might be a blood glucose, urine glucose test, right? And he might order some other urine tests also, culture, etc., to find out what's wrong, right? So those tests and all will be listed. The history will be listed, like why you came to him, what was the major thing that made you visit him. So these things and all will be documented. Then you will have the tests that are ordered by the provider. Then he will document your physical exam. He'll make you sleep on the table, come and physically inspect all your different systems of the body. He will write that down as physical exam. And after that, looking at your test results and everything, he will give you an assessment and plan, right? So then you have the record that contains all these major things. That is your history, exam, medical decision making, right? And your tests that are ordered and your diagnosis and your procedures that were performed, right? All these things will be there on the record. Then finally, he'll sign off on it. Okay. All this data, when it gets generated as a medical record, it's going to reach the coder. Okay. It's going to reach the coder. So when we see this medical record document, we read through all these things. Okay. And we have to actually, what we are supposed to do after seeing all these things, the physician has to send this record to the insurance company. Why? Because patient is not going to pay. Why? Because patient will say, I have paid premium, right, all my life to the insurance company. So I'm not going to pay you anything, doctor. You have to give me all the service. Right? I am entitled to medical service because you have to treat me in US. There is no other way. You cannot you cannot deny medical care at any cost in US, right? So the provider has to give the care. So once he finishes giving the care, he will generate a bill amount, right? And he will say, okay, this is the bill. But then what will the patient tell? He will not pay for the encounter. He will not pay a single pipe. Patient will say, see, I have been paying premium for the insurance company all through my life. This is my insurance details. So this is my primary insurance. This is my secondary insurance. This is my tertiary insurance. You have to submit a claim to the insurance company with my details. Ask them to reimburse you for whatever amount you have charged me, for whatever service you have given me. So am I like audible to all of you? Are you guys able to follow whatever I'm saying? Do you want me to go a bit slower?
No, ma'am.
Is that okay? All of you are okay? You're able to hear and understand whatever I'm saying? And also
Yes, ma'am.
see the screen as well? Yeah? Okay.
Yes, ma'am.
Yeah. So now, once they say all this, okay, once they say all this, so imagine the number of patients that a doctor sees in a day. If for one outpatient record you have one generation of one record for one outpatient, imagine in a day in a facility how many outpatients will be there, how many records are generated, right? So now it is impossible for any insurance company to take a look at all these records, understand what has to be paid, what doesn't have to be paid, and then send the money back to the provider. It becomes a difficult. So what do we do? This is where we come into picture as coders. We come into picture, we look at those medical records, right? We understand medical language, medical terminology. We read the record of the provider in their language, and then we convert all the diagnosis into ICD-10 codes. That system we are going to use. Okay. For example, if it is diabetes, yes, I'll get back to you, Asha. Give me 2 minutes, okay? I'll get back to you. Whatever I have said, I'll repeat it for you, my dear. Just give me 2 minutes, okay? Let me complete this, then again I'll repeat it back. Okay. So
it is I10 for diabetes.
ICD-10, ICD, International Classification of Diseases, 10th Clinical Modification, ICD-10 CM. Okay, I'll repeat it. Yeah, I'll repeat it for you. Don't worry, I'll repeat it for you. So all the diagnosis, we are going to convert it into ICD 10 CM, International Classification of Diseases, 10th Clinical Modification. Okay, ICD 10 CM. All the diagnosis, we convert it into ICD 10 CM. All the procedures, like they might have performed some minor surgeries, major surgeries, they might have performed some repairs if at all you have laceration or cuts. Okay, they might have removed foreign body from your ears or your eyes, wherever, right? So these are all procedures, no? They might have performed an X-ray, they might have performed an MRI, a CT scan, mammogram. All these things are procedures. So all the procedures we are going to convert it into current procedural terminology, CPT, current procedural terminology. All the diagnosis getting converted into ICD-10, all the procedures getting converted into current procedural terminology codes. Then, apart from these two, we also have supplies, right? Spectacles, crutches, bandages, right? Nebulizers. These are all supplies. Your vaccines, all those things are also supplied by the provider. So those supplies also we are going to code, right? So those supplies we are going to convert them into HCPCS codes. HCPCS. HCPCS. Healthcare Common Procedural Coding System. Okay. So this is the system of codes that we are going to employ, which is set to us by WHO AMA for the US. So we are going to go through the guidelines how to code these records, right? So now let me come again, since some of you have asked for repetition. I'll just repeat the process once again, guys. You can listen once again. Okay. So basically, what do we do here in India? We pay for the service then and there itself. The same day we're going to pay for the service. So there is not going to be any problem between us, provider, and the insurance company, right? Unless you are really insured for outpatient visits. Whereas in US, things are different. There, everyone will be covered under some form of insurance, right? They will not pay the doctor for anything. They will say, we have already paid for insurance. So you go and submit this to the insurance. Insurance will reimburse you back for whatever service you have provided. So in US, when a patient meets a doctor, they are not going to pay for the service. They are going to avail all the services from the provider. The provider cannot deny medical care in US. They have to give. They have to take care of the patient. Okay. So they will take care of the patient. They will give all the services. They will generate a medical record which has to be sent to the insurance company, so that insurance will sit and decide these procedures are payable, these are covered services, these are not covered services, right? So these things have to be done by the payer, right? Now, payer doesn't have the time, task force, or people to sit and read all these medical records which are generated. So what do we do as medical coders? we take a look at these records, right? We convert them, pages of records, right? If a person is getting admitted for 1 month in a hospital, imagine the number of records that are generated. Every day, at least 2 or 3 consultations if he is going to have, how many records are generated, right? So all those records we are going to see, and we are going to convert all that huge amount of data into alphanumeric codes, which are just 4 to 5 digits long. Okay, just 4 to 5 digits long. So looking at that, we are going to, yes, these services are totally related to USA. What we are going to study, the system of codes, it belongs to USA, it belongs to America. So all those things we are going to convert it into codes, and we are going to send one sheet, right, which contains all your codes, which contains your diagnosis, it contains your procedures, it then contains your assessment plan, everything, all your details, whatever was done. So each of those are associated with a dollar value, right? For example, we went with a chest pain, right? So when we went with a chest pain, when we went with a chest pain, the provider is going to do some electrocardiogram he can order, right? So he might order a 12-lead electrocardiogram or a 3-lead electrocardiogram he might order, right? He might order some troponin and enzymes, right? So just to rule out your heart attack or something like that, right? So when he is going to do all these services, then we are going to convert that electrocardiogram. So you look at the report and you convert it into a code, right? That's coding. So when you look at electrocardiogram, so there are many codes for that. Okay, so you have to know the guidelines to select the proper code, and that particular code will be associated with a dollar value, right? So that the payer or insurance company is going to pay back that dollar value to the provider. Okay, provider is not going to get paid until we send all this data to the payer, which is the insurance company. An insurance company will look at this data, they will see the fee or the price, right? And then they are going to say, okay, boss, out of these services, these are all covered service, we will pay. These are all not covered, we will not be able to pay. So this is what the payer, that is the insurance company, will come back and tell the provider and the patient that these things are paid, these things are not paid, right? So our job is to make sure that the provider gets properly reimbursed for all his services that he's providing. There is a delay of around 1 month time because of the revenue cycle management cycle which happens. And because of that, there is a delay of around 30 days because provider will not get paid instantly. He will always have to wait for his record to pass through the cycle to go to the insurance company, and insurance company has to come back and give the money back to the provider. So it takes around a period of 1 month. So in US, this entire revenue cycle management is there. That is right from where the medical record is going to get generated until when the payer is going to give back to the provider. This entire cycle is outsourced to us, to India, because they can't handle this process there. It's very, very costly. So the entire thing is outsourced to India. So as Indians, we have many medical coding companies everywhere in India, north and south, everywhere. We handle the entire cycle for the provider who is in US. Okay. So now comes the question, how do you do this? Right? How do you carry out such a huge process? Yeah. So how do you use this? Right? So how we are going to employ the process, right? So first thing, we need to study medical language and medical terminology, right? Without understanding medical language and medical terminology, we will not understand what the report is about, correct? So in our course curriculum, first thing you're going to study is medical language, medical terminology, anatomy and physiology also you should know, because physicians have a different language. They don't use common language like you and me, right? So they use different languages. So that language we call medical language, right? So for you and me, kidney is just a kidney. But when we talk about saying, when I say kidney stone, it's in layman's terms that I'm saying kidney stone. But when doctor writes, it will not be kidney stone. He will write it as nephrolithiasis, which means presence of stone in the kidney, right? So we are going to read all this. We're going to study all the medical language, medical terminology, so that we will be able to decipher what exactly the doctor is trying to tell us. And apart from that, we are also going to understand procedures, what and all are performed, and how to convert them into codes. And you cannot just randomly pick some code for some procedure. You cannot do that. You have to have proper understanding of the guidelines. And guidelines is what we are going to help you with, right? So in this course curriculum, we are going to cover the ICD 10 CM. Before that, anatomy, physiology, medical terminology. After that, we are going to get into introduction to ICD. After that, we are going to get into your CPT, right? After that, HICPICS, and then finally, all the mock tests, everything we will cover you for the whatever exams you might want to take it up. So for all that, we are going to have you covered. So in a gist, this is what we call it as revenue cycle management. Okay. So for example, if you guys want to see how a code looks, I can share that with you, because some of you are asking me, like, how does a code look, and how we are supposed to use that. Okay. So yeah. So see, when we are talking about insurance or the payer, as coder, it is our duty to convert it into codes, and we will share it with the medical billing team. So medical billing is different. So that team will take care of your data. Our job, our main job is to make sure properly the codes are put on the record. Why? Because if you change the code, now it becomes something else altogether. For example, a 3-lead electrocardiogram was performed. You just think that it was a 3-lead. Okay, if it is electrocardiogram is a tough word, let's go with simple thing like an X-ray. Okay. So one view of chest X-ray was one view of chest X-ray was performed. Okay. So one view of chest X-ray is $500. By mistake, you coded 2 views. One view is 7, 10, 20. By mistake, you coded that as 7, 10, 30. That is 2 views chest X-ray. And that dollar value is $900. This dollar value was $300. So, the dollar value changes will be there if you don't know which code to select. And do you think whatever we code, insurance company is going to come back and pay us? Certainly no. If you're going to overcharge the patient, do you think patient will keep quiet? She will come and tell the doctor, you did not do this process written data screen. Yeah. So you can just give me any, disease, and I'll give you the code for it. You can try. Anybody can give me any name of any disease?
Ma'am,
Yes.
aplastic anemia.
I'm really sorry, my dear. I didn't catch that. Can you come again?
Aplastic anemia.
Aplastic anemia. Very good. Okay, fine. So aplastic anemia code we will see. So the code for unspecified anemia, you're able to see B64.9, but you asked for aplastic anemia, right? So under anemia, I have to see aplastic, which leads me to this code, which is D61.9. Okay? Got your code for aplastic anemia?
Yes, ma'am.
Yeah? Yeah. Any other codes? Any other diseases you want to try? Allergic rhinitis, asthma, cool. So let's go with asthma first and then with allergic rhinitis, okay? You want unspecified asthma, extrinsic asthma, childhood asthma, what kind of asthma? Unspecified is very easy, you'll get it. Other codes, other kinds of asthmas are also there, right? Allergic, so many different kinds. So we'll go with unspecified asthma since you asked asthma. So unspecified asthma is, what is the code? Can you read the code for me? Can you read the code for me?
J45.909.
Exactly, that is the code for unspecified asthma. And somebody else asked me for allergic rhinitis. So kindly do not use any of the websites for coding. They're not updated. They are free stuff, which means they are really not good. Okay, so it's a disclaimer. We never use any websites for coding. Okay, especially while you're training for coding, kindly refrain yourself. This is just for demo. I'm showing this website. You are not supposed to use any of these websites because when you are going to take a competitive exams, no websites are allowed, no material is allowed there. Okay, only books are allowed. So we are going to share the whatever books or material is there. We're going to share it with you. In case you decide to join the session, you will be provided with that. Okay, so kindly do not use this because none of you know anything about coding. It's my job to warn you not to use this website because it is not updated. These are all free stuff. Okay, sometimes it shows old codes and you try to use old codes on this year's codes, it is not going to work out properly for you. Okay, and guidelines will be missing from here. Some small guidelines, important guidelines are missing from the websites. So we usually generally don't advise you to look at any website. I just want you to see how the code looks. That's the reason why I'm taking you here. Otherwise, I would not. Okay. So you said allergic rhinitis. Okay, unspecified rhinitis is J31.0. Let's take a look at allergic rhinitis. So what is the code for allergic rhinitis?
J301.9.
J30.9. Did you see the difference? Just the term allergic, it changed the code altogether. Yeah? Correct, no? So unspecified, what was that? Unspecified was 0, J31.0. But allergic is J30.9. Yeah? So minor differences also will change the code altogether. Imagine you're looking at a record, patient is normal, by mistake you coded HIV positive. Just imagine. B20 is the code for AIDS. By mistake, instead of coding C20, you coded B20. Just imagine. And those codes are going to go through US. If you're going to code for US government, CMS, it will go there. Is that okay? Is that okay? Not right. That's why we need to know everything. Like we need to have a clear picture and we need to have quality. Quality is a very major important aspect in coding, which is true of any profession, right? Whichever profession you want to go and get into, quality matters a lot. Right? So here we are going to teach you all that, how to pick the codes correctly. By mistake, you code some female diagnosis on a male patient. Is the insurance going to agree? Is it going to agree? You code prostatitis on a female patient by mistake. Is that okay? No. You code something female diagnosis on a male patient? No. You code an obstetric code on a newborn child. Is that okay? No. So there are a variety of guidelines that we need to understand and follow for us to pick the course. Now, coming to who all can join this course, right? So we do not have any restrictions that you should be of science background or you should always be of life science background only. And people from other backgrounds are not allowed. There is nothing like that. Anybody who is a graduate or a diploma holder is more than welcome for this course. Because even though you might not know anything, we are anyway going to train you for anatomy, physiology, medical terminology. It's a part of the course. We are not going to remove that. We're going to have it with us. And then we are going to get into coding. So if you are really interested in this field, you can also come. You're more than welcome. And when I was a manager, I have promoted personally so many people who are not from science, but they were so good at coding. They were so good at coding. And as and when you get experience, you will get used to it. So there is no hard and fast rule that only people from science background should come here. Anybody who has a degree, a bachelor's degree or a diploma is more than welcome. Then coming to your, yes, Maithili, you can ask me a question, my dear.
Yes, ma'am. I have a doubt. Does the code changes every year? They will update the code?
Yes.
Yeah, it will be a standard one, ma'am.
Yeah, I'll tell you. So every year we have new diseases. Zika virus, 10 years back, did it exist? Corona, did it exist 10 years back?
No.
So every year new diseases are there. Every year new code books are released. But you don't have to buy them. Let me tell you why. When you join your company, you're going to not use books. You're going to use softwares. So all those softwares will be updated by the company itself. So you don't have to worry about the code changes. Yes, there are going to be code changes. Some of the codes may get added, some of the codes may get deleted, right? But it's not going to be a major factorial change. It's going to be minor changes and they will update you. You will have meetings with your companies. The team lead or whoever is the supervisor for you, they will come and update you every October, every January when the code books change. They will come and update you with the guidelines. So these are going to be very minor changes, nothing to worry.
Okay.
And you don't have to keep buying books for every year. That's not
that's
required.
what I-
One code sheet, if you buy for training, that's more than enough.
Okay,
For that, you don't need anything. And one thing is, for your finals also, they will only give AAPC, will, the certifying body will give you the books. That also you don't have to, original books you don't have to buy. What we are going to share with you will be most likely a photocopy. That is enough for training purpose. When you
Okay.
take up your exam, AAPC will take care of your books. So you don't have to
Okay.
spend on that.
Okay, ma'am. Thank you.
So did I answer your doubt, my clear?
Yes, ma'am. Yes, ma'am. Thank you.
CPT and HIPIX, yeah, sure. Okay, I'll show you examples of CPT codes. Second. Taking you to the page. Meeting controls for usually. Sure. So you guys are able to see the codify screen. It says codify by AFSC.
Yes.
Can you all see the screen? Yeah.
Yeah.
So this is a deleted code. So somebody was asking me now how often it gets deleted, how often it gets added. So I just showed you the example for a deleted code. 71020 is an old code. We don't use it anymore. Okay, like that you will have CPT codes. Okay. So for CPT, we don't have any free websites. That's the reason we cannot take you easily there. For IC return, we have free websites. CPT and all, you'll have to search in the books. And when you get into the company, again, they will have websites for you. There you can see. Okay. What is the duration of the training? Do you provide any placement assistance after completion? Charges for the course. So these data and all, you'll have to ask the customer care of Henry. They'll help you with all this data. Okay. So placement assistance and charges and all, you contact Henry, they'll get back to you. Okay. Any other questions you guys have? Okay. So did you guys understand what do we do as coders basically? Right? We convert the information into alphanumeric codes. Okay. And it is important because, again, you should know all these things, like in the sense anatomy, physiology, because otherwise, see, even without understanding anatomy completely also, you can code. But still, it will be like shooting in the dark. You will not realize what you're doing, right? You just put the code, but exactly what is happening, you'll not be able to follow, which is why we will take care of that. Okay. What will be the pay scale? Yeah. So with the pay scale, I can help you. So yeah, coming to the career, good question. Okay. So coming to the career opportunities, we have lots and lots and lots of career opportunities in India. We have so many innumerable number of coding companies here. Okay. Very well established, not starting. It's a very old career path. Okay. It's not started 1 or 2 years back. Okay. Many years ago it started. I myself have 14 years of experience and I have 2 certifications from AAPC. 2 international certifications in coding. Okay. So it is a very old, very cool job. Okay. Where you will get to know or read patient records, right? And also you'll be converting that information into codes using the knowledge that we are going to give you, right? So here in India, in South India and in North India, very many coding companies are there. Okay. Very easily you will get into coding. And it's a 9 to 6, 9-hour job, day shift. There is no night shift in coding. Because once the doctor finishes creating the record, it will be morning for us. So when we sit in our system and when we'll code, then it is going to be morning for us. It's a day job, no night shift, 90%. And after 1 or 2 years of initial work from office, you will be, if you are really good at your job and you don't require any assistance, you might opt for work from home also. That depends on your company. Okay. And coming to the pay scale, beginning you'll get a 23 to 24K package. per month you'll get. Okay. So starting for a medical coder, it is 23 to 24K. After 1 year of experience, you will become for 2 years, you become senior medical coder. Every time you jump the scale, your salary will be high. Every year, even if you don't jump the scale, appraisals will be there. It is continuous development. Okay. Even if you don't get designation also, they will give you a hike. That is also there. Okay. So here, if you are really good, the point is you should be good. It depends on you, right? Quality depends on you. How well you handle yourself in the company. How well do you have the knowledge about coding, right? These things and all are going to be dependent on you, right? So pay scale is starting 23K. After that, after 2 years, it will every time you can keep adding 3,000. Okay. For designation, you can add up to 4,000, right? So if at all you become a senior medical coder, then 3. Then again, after that, 1 or 2 years, you'll become a quality analyst. Then again, you will add. So a quality analyst will be getting anywhere around 55K. Okay. Then again, next, after that, you are going to become a group coordinator. You'll get into management. Until then, it's technical. After that, management. So you can either get into management roles or you can stay in technical roles. It's up to you, right? So if you have the skill sets that are required for the better roles, they'll obviously give you better roles. It's a complete corporate environment. Okay, and it's a very, very respectable career for women. Most of the times we say that because it's a day shift job. All you need is your system and your information and your records, and nobody is going to bother you much in this field. Okay. So yes, Maithili again had some question.
Ma'am, actually, I'm planning to work from home, ma'am.
Okay.
Actually, I have a healthcare background also.
Okay. Question regarding work from home. See, initially, I'm not going to tell you that you will get work from home from day one. That will be wrong. Okay, why? Because even though you know healthcare, coding is new for you, right? So they might want you to have a buddy system, that is somebody else to help you. So in the organization, when you go, they will give you training for that. So your first few months of training will happen in office, Maithili. Okay. So once you finish your training in office, once you prove to them you're really good at what you do, that is your coding quality percentages and all, right? You have, then after that you can shift and say, sir, I prefer work from home. Do you have that policy in your company? Then give it work, right? Okay. And now everyone is working from home. Now all the coders are working from home because it's pandemic. No offices are open. Yes, we do have opportunities for foreign sitting in India because it's a US process. If you come to a better position other than a coder, that is if you become a QC or if you become a team lead and above, if you become team lead, team managers and all, they travel to US because process is there, client is there, right? So every now and then you will have the opportunity to travel and you can go and come to US. So basically US process. So yes, you can earn in, if of course you're working in US, you're going to earn in dollars, right? So that's how it's going to be. But if you're going to be associated with companies also, right? So even otherwise also, if you're going to be a freelancer, that also can be done. But the opportunities are rare over there. If you're associated with the company, it will be better. Okay. So did I address that issue for you, Maithili? Somebody else had a question? Yes, you can ask me. Subhashini, somebody asked me a question, right? Yes, ma'am. Come again. Tell me. Medical coding, can we go to Dubai? Of course, you have overseas, you have so many like Dubai, Abu Dhabi, right, US, all these are filled with coders. You should be certified. Once you're certified, you can travel and you can go, you'll get very good salaries. You can settle there also. That is also there. Because those places also utilize the same system. So yeah, you can go there. Yes, CPC is the most popular certification. Okay. CPC is the most popular certification that we are going to train you for. It's the most popular, most common, most widely accepted certificate, right? So we're going to train you for that. Yes, CPC is enough. You have to get through CPC, that is enough.
Ma'am, please tell me the full form of CPC.
Certified Professional Coder. It's a credential given by American Association of Professional Coders, AAPC, which is the US certifying body. Okay. So once you finish your course, right, once you finish your training sessions for coding, it's up to you, entirely up to you to take up the exam or not. Okay. And it is completely a freelance exam, no age bar. Okay. There is no time limit like within this year, I take nothing like that. Any time in your life, you can take the exam. Okay. It's entirely up to you whether you want to take it or not. That is also up to you. In India, companies are there which accept people without certification. There are companies which accept people with certification also. But however, if you have a certification, obviously it is going to be good, right? Because we will call you a certified coder. So you want to get the certification from the US organization, which is AIS. Okay, so of course, when you go for an interview, when you have a bunch of people sitting there, person will try to take higher certified coder. Of course, it's going to be that way. But even it's not like non-certified will never get. You will also get opportunities. But again, salaries also will vary like that. So a person who is certified may get around 2 to 3 K extra salary. Okay. Yes, CPC is open book. Very good. Yes, that's correct. Here in our coding, there is no concept of memorization. No, there is no need to remember anything. No need to remember the codes because there are over 30,000 codes. There is no concept of memory involved in coding. You don't have to remember a single thing. It's all open book exam. You'll be allowed the book in the exam. You can open it, refer it, understand, apply the guideline, and come. This is concept driven, not memory driven. So remove that from your mind that I have to sit and by anatomy, I have to sit and remember these codes. It's humanly impossible to remember 30,000 to 40,000 codes. Don't worry, we are not asking you to memorize anything, not a single thing. Everything is there in the book. You read the book, understand the concept, know where you have to apply, which concept, which guideline, where to apply. That we are going to teach you. And if you know that, it's an. And yes, CPC is open book. APC provide you with the details. They will give you the books. You don't have to pay for it. Yes. Yes, Shafina. Yes, Shafina, you have a question, my dear? How can we start our own coding company? Okay, it involves a lot of compliance, my dear. It's not so easy. Okay, so you have to have a lot of experience in the field. Without experience, we cannot do anything. I appreciate your, long-term goals. I really appreciate it, but then we cannot start so fast. Like we need to understand first basics, what is coding, everything. You need to have your team. You need to create your own team, your own company, right? You need to catch hold of US clients, and then you need to catch hold of what kind of coding they are looking for, right? It's a process. It won't happen in a day. Rome was not built in a day, right? Like that, it takes time. Yes, it is very much possible. I'm not going to say no. It's very much possible to have your own medical coding company. I appreciate it, Deepak. I think it was Deepak who wanted to ask that question. Very good, Deepak. Deepak, it's a good, zeal to start your own something, right? Very good. I appreciate that. Yes, it can be done, but it is going to take and patience, a lot of patience, right? Because you need to understand the field properly. So many compliance issues are involved. Here, we cannot just start a company, right? We need to have a lot of permissions, right? Because it's a US process. A lot of permissions are involved. We need to get ourselves certified from ISO, ISMS. Not so easy, but yes, possible. Okay? After a certain period of time, it is possible. And I appreciate your zeal to start your own.
Ma'am, shall I ask?
Yes, my dear. Yes, my dear. Yeah.
Mm,
I'm not sure about Europe and Ireland.
once we complete this course, we'll get the cert.
1 second, my dear. 1 second, my dear. Sohini, I have no idea about Europe and Ireland, my dear. I don't know which system they use. Okay. All I know is for Abu Dhabi and for Dubai and all, our coders are getting selected. That I know. CPC coders are getting selected there. That much information I can tell you. Europe and Ireland, I have no idea, ma. Whether we are going to use the same system or not, we're not sure. Okay. And yes, Michael, yes, now you can come with your question.
Yes, ma'am. Once we completed the course, we'll get the certificate, ma'am.
You will get a certificate that you are trained.
Trained,
Yeah, trained in medical coding.
but we have it's our own wish that we can take the test or
certification. Yeah.
APC certification, ma'am. But everywhere they are asking APC certification.
Yes.
So is it mandatory, ma'am?
It is not mandatory. It is like, okay, let me put it this way. Do you know who a cook is, right? Cook, a normal cook. And you know who a chef is, no? What's the difference between cook and chef?
Yeah, they are professional chefs are professional, ma'am. They are certified by a company or organization.
Okay, that is the difference. Okay, so people prefer certified. And for the certification, without training, you cannot do. Whether you want to get yourself certified, whether you don't want to get certified, either way, training is required for both. Without training, such complex things you cannot understand. It will be very difficult. You need training. Whether you want to get certified or don't want to get certified, if you want to become a coder, you need training. Without training, it's difficult.
Okay, ma'am.
Got the point now, Maithili? So
Yes,
if you
ma'am.
want to, and one more thing, let me tell you. See, you might be thinking it's very long. I have to first get trained, pay for training, then I have to get certified, pay for certification, then I'll get the job. See, don't worry. Within 3 months, if you're getting 23K as your salary for 1 month, 3 months you'll get back your amount, no? Entire amount that you have invested in 3 months, you'll get it back. It's not going to go anywhere. The same thing you're going to get back within 2 to 3 months, right? Correct, na? So it's not a huge thing. And one more thing you have to understand why we are charging like this is why it is like that is because it's a US organization. If it's a US organization, it's going to be in dollars, no ma? Their currency is dollars, right? Our currency is rupees, but their currency is dollars. They're going to charge in dollars. Understood? No? So don't worry about those things. Whatever you're going to invest will surely come back to you if you're good at what you do, which we will make you good. Okay. We can't beat in first attempt CPC. Who told you that we cannot beat in first attempt? Who is this? Mohammed Shafina, right? Shafina, no idea. It's nothing like that. See, it depends on you. Okay, how you are preparing for the exam, right? How you take the mock test, how you listen, how you answer. All these things depends on you. Many people will be able to crack it on the first attempt. Some of you will be able to. So what? You have another free attempt. You're not going to pay for the second attempt, right? If you pay the fee once, you'll get 2 attempts for the exam. Okay, so second fee, my dear, you can again attempt it. No problem. And second attempt, no need to pay the amount. Whatever amount you paid for the first attempt, same amount. No need to pay again. Okay, so yes, many people crack it during the first stage, many people crack it during the second stage. We'll take a, like, we'll give you proper training, mock tests, everything, timed tests we'll give you to make sure that you're going to crack it on time. Okay, that's all. Somebody. Exam fee is included in the total fee charges. See, this amount commercial, please don't ask me. This you ask Henry.
तो मैम
Yes.
मैम इसमें कितने टाइप के कोर्स है मैम सीपीसी और एसपीसी और क्या अलग अलग टाइप के कोर्स है क्या मैम आईसीटी
Your voice is very feeble. May I know who's trying to talk?
आप बता रहे हो मैम सीपीसी
आप मेरे को चैट में टाइप कर दो यार. आपका वॉइस बिल्कुल भी सुनाई नहीं दे रहा है मुझे. बहुत फीबल है. आप एक बार टाइप करके तो लिख दो चैट में. मैं देख के मैं फिर से आंसर करूंगा. ठीक है.
मैम मैंने आपको इतने मैसेज करे आपने रिप्लाई नहीं करा मैम.
आई एम सो सॉरी यार. मेरे को सच में सुनाई नहीं दे रहा. बहुत फीबल है आपका वॉइस. अब एक बार टाइप करो. अब कौन बात कर रहे हो?
मैम आई एम आशा कौशिक.
आशा कौशिक. हाँ हाँ. अभी थोड़ा जोर से बोलो यार. हाँ बोलो. क्या चाहिए आपको इन्फॉर्मेशन?
मैम मैं जानना चाहती हूँ सीपीसी का आप बता रहे हो ना सीपीसी में कोर्स
इंग्लिश में सॉफ्टवेयर
बताया था.
आई एम नॉट एबल टू हियर यू माय डियर. आई एम सो सॉरी. यू कैन टाइप योर मैसेज एंड आस्क मी.
मैं चैट
अब टाइप तो कर दो. मैं देखता हूँ. आई विल जस्ट सी एंड आई विल टेल यू. टाइप योर मैसेज मा. टाइप योर मैसेज. Lie down, Ray. Type your message. Henry phone number. I think you'll get it on the website, no? How did you get this, Shafina? How did you get this Zoom link? Who shared it with you? Shafina, you contact Henry through the link that they've shared you. Okay, just call them through that. Right? They'll take up your questions. Okay. Anything else? Any other questions you have? Phone number, I've checked in email. Okay. So don't worry, Shafina. Shall I ask them to get back to you? Henry, guys? They'll get back to you. Don't worry. I'll ask them to get back to you. Is there any other course in medical course? I don't know. I am only dealing with medical coding. Medical coding course. Henry offers this. Why is this difference? Deepak, I'm really not into. I'm not the point. Or I'm not the person to discuss commercial, my dear boy. Okay, so I can only help you with training. The remaining things and all, you talk to Henry. Okay, I have no idea what is the I'm not going to get into all that because that's irrelevant to me as a coder, right? So I cannot help you there. But contact Henry. So they'll get back.
Ma'am,
Yes, yes, Subhashini.
Ma'am, I have done bachelor's in medical record science from CMC Vellore. So coding and anatomy, physiology, terminology and all were.
உங்களுக்கு எல்லாம் தெரியும் திருப்பியும் எதுக்கு கேக்குறீங்களா? அது வேணாம்னு சொல்றீங்களா?
அப்படி இல்ல மேம். I was a professor also for the health information technology. I have taught my students. So I just want to know whether நான் வந்து டைரக்டாவே சிபிசி எக்ஸாம் எழுதலாமா இல்ல.
ஓகே, சோ உங்க क्वेश्चनக்கு இப்படி ஆன்சர் பண்றானே, நீங்க எல்லாமே உங்களுக்கு அனாட்டமி பிசியாலஜி எல்லாம் நல்லா வந்திருக்கும் சரியாமா? அது வந்து உங்களுக்கு எதுவுமே ரிவிஷன் கூட வேணாம், ஏன்னா உங்க ஃபீல்டே அதே தானே. சோ அதனால உங்களுக்கு எதுவுமே வேணாம். ஆனா நீங்க கோடிங் பத்தி உங்களுக்கு என்ன தெரியும்? கோடிங் கைட்லைன்ஸ் பத்தி உங்களுக்கு என்ன தெரியும்? சிபிடி தெரியுமா? ஐசிடி தெரியுமா? ஹிக்பிக்ஸ் தெரியுமா? கைட்லைன்ஸ் கேக்குறாங்க சிபிசில. வெறும் அனாட்டமி மட்டும் இல்ல, அனாட்டமி வெறும் 10 மார்க்ஸ் தான் எக்ஸாம்ல. 60% ஆஃப் த மார்க்ஸ் சிபிடி வேணும், 40% ஆஃப் த மார்க்ஸ் ஐசிடி வேணும், ஹிக்பிக்ஸ் வேணும். கோடிங் கைட்லைன்ஸ் சாப்டர் வைஸ் கேக்குறாங்கம்மா, கேக்குறாங்க. அதெல்லாம் உங்களுக்கு தெரியும்னா கான்பிடென்ட்லி அப்ளை பண்ணுங்க. அதெல்லாம் தெரியாதுன்னா சும்மா போட்டு வேஸ்ட் பண்ணாதீங்க, ஏன்னா ரொம்ப காஸ்ட்லியா இருக்கும். சரியா? நீங்க இன்வெஸ்ட் பண்ணாலும் கரெக்டா ட்ரைனிங் எடுத்து கரெக்டா கம்ப்ளீட்டா சாப்டர் வைஸ் கைட்லைன்ஸ் எல்லாத்தையும் நான் சொல்லி கொடுத்து உங்களுக்கு மாடிஃபயர்ஸ்னா என்ன, காம்ப்ளைன்ஸ்னா என்ன, பிசினஸ் ஆஃப் மெடிசன்னா என்ன, கோடிங்னா என்ன, சிபிடி ஐசிடி ஹிக்பிக்ஸ் சொல்லி கொடுக்குறேன்.
I have taught my students also.
Then you try, ma. No problem.
So I'm just asking. I'm not going directly. I know it's not good because
so it's up to you. See, உங்களுக்கு கான்ஃபிடன்ஸா நீங்க சொல்லிட்டு இருக்கீங்கல்ல, நான் எனக்கு தெரியும் கைட்லைன்ஸ் அப்படின்ட்டு. பண்ணுங்க, அதுல என்ன இருக்கு? If you are sure and confident, go ahead.
No, I'm not having confidence in that because I done ICD 9 and 10. I have taught my students also. So I was just
current procedural terminology.
Current procedure. I don't know much.
See, 60% of your CPT only.
No, I'm not going to go. I'm just asking.
That's what I told. No, did I answer your question? So without training, don't attend. That's what as a trainer will tell you. As a trainer, what we tell, without knowing, because இது வந்து காமனா இந்தியாவில் எடுக்கிற மாதிரி எக்ஸாம் கிடையாது, இது இன்டர்நேஷனல் எக்ஸாம். இதுக்கு உங்களுக்கு ப்ரிப்பரேஷன் தேவை. கோர்ட்ல ப்ரிப்பரேஷன் பண்ணி போங்க அப்படின்னு சொல்லுவோம், அவ்வளவுதான். அப்புறம் உங்க இஷ்டம், நீங்க கான்பிடென்டா இருந்து இல்ல நான் படிக்குவேன் நானே படிச்சுக்குவேன், ஓகே, இட்ஸ் அப் டு யூ.
Not like that. I'm just clarifying my doubt.
Don't worry, my dear. No hard feelings. Don't worry. Don't worry at all, ma. Yeah.
One more question is that.
Yes.
Working women join the company for coding.
Already you're working somewhere, you want to do coding.
No, I'm asking generally. Can a working woman join the coding?
You can't do that. In corporate, it's not possible. Two things you should not do. One leg there, one leg here. That is not possible. We don't usually recommend that. Because it's a 9-hour job, no? பார்ட் டைம் வேணா பண்ணிக்கலாம், ஆனா ஸ்டார்டிங்ல வந்து உங்களுக்கு ட்ரைனிங் எல்லாம் தரணும்னா அவங்க ஃபுல் டைம் தான் கேக்குறாங்க. யாருமே கம்பெனிஸ்ல பார்ட் டைம்ல எடுக்க மாட்டாங்க ஸ்டார்டிங்ல. அப்புறம் எக்ஸ்பீரியன்ஸ் ஆனதுக்கு பின்னாடி நீங்க கேட்கலாம், இப்போ எனக்கு வேணா ஃபுல் டைம் முடியாது, இப்போ எனக்கு 2-3 years தான் வேணும் அப்படி கேட்டா அவங்க லைக் no, that is not like, that's not the general process where people take you for part time. That doesn't usually happen.
Okay. Then how many months they'll give full time job?
How many months? A permanent job, then. If you take up medical coding, it's going to be a permanent job for you.
Yes, ma'am. Thank you so much, ma'am.
Sure, my dear. Anytime, ma'am. எதுவுமே இல்ல, நீங்க ஆறாம உட்கார்ந்து யோசிச்சுட்டு அப்புறமா நீங்க. எஸ் மைதிலி.
இந்த கோர்ஸோட லிங்க்ல வந்து ஹென்ரில ஏதாவது டெஸ்ட் Yes, ma'am. In the course or எண்ட்ல டெஸ்ட் ஏதாவது வைப்பாங்களா மேம்?
Oh, every whichever topic I'm covering you,
conduct பண்ணுவாங்களா?
yeah, whichever topic I'm going to cover, every topic test I'll give you.
Okay.
Every topic assessment இருக்கும். And guys, listen to me. This is not going to be a normal test where I'll ask you 10 questions, you'll give me answer for 10 questions and you're done. That's not going to be like that. See, coding is different from Indian exams, which is why here we are going to concentrate more on discussions. We are going to concentrate more on rationales. Why you're correct, why you're wrong is what we are going to discuss in these sessions. I am not going to ask you to give me the code and keep quiet. I will not say it is correct or wrong and just keep quiet. No. I will tell you why it is correct and why it is wrong. Because rationales matter a lot in medical coding. So if you have to understand the code properly, then you should know where you went wrong and how to get the correct code. Right? The appropriateness we have to sit and discuss. So it is going to be more in terms of discussion rather than just a question and answer session. Okay, Maithili, did I address your question?
Yes.
Okay, guys, we're almost time.
It will be an interactive.
Yeah, Maithili. Yeah, Mohsin. I think I took many Maithili's questions. Mohsin, yeah, ask me, buddy. What do you want to ask me, Mohsin? Mohsin, you have raised your hand.
Hello, ma'am.
Yes, Mohsin. Hi. Tell me.
Yes, ma'am. Please tell me about the CPG certification exam, ma'am. What is the procedure? How to obtain?
So you have to get yourself registered with AAPC. Okay, first you have to get yourself registered with AAPC, and then you can schedule your own exam. Okay, whenever you like, you can, once you finish your training, once you're confident that you are okay attending that exam, you can go ahead and register yourself for the CPC exam, and you can choose the date where you want to write the exam after paying, right? So then you can decide for when if you get through the first attempt, awesome. If you don't get through, no need to be disheartened. Second attempt also you can schedule on your own. So all these things you can do on your own. Whenever you want, whenever you're confident, after 3 months after training also, you can take up the exam. After 1 year after training also, you can take up the exam. Whenever you want, you can take it up. You are the one who's going to schedule your exam. Okay? And once you pay, you're going to pay for 2 attempts. It's going to be an open book exam. Okay? You are allowed books in the exam, which is the certified code books from AAPC. That will be allowed for you. You can open, see the book, understand the concept, apply it, get your certification. Okay, so 100 questions will be there, out of which 70 questions you have to answer correctly. मतलब आपको 70% लेना है. अगर आप 70% लोगे तो आप CPC credential आपके नाम के beside में आ जाएगा. ठीक है? So you will get your credential as CPC certified if you pass with 70%. Okay, Mohsin, anything else can I help you, buddy? Yeah, tell me.
फीस मैम, फीस कितना होगा?
फीस आपको डॉलर्स में चेक करना पड़ेगा. उस दिन का डॉलर वैल्यू क्या है उसके ऊपर जाता है ना. सो इट माइट वेरी ना, एवरीडे डॉलर वैल्यू चेंजेस, राइट? इंडियन रूपी टू डॉलर, right? So if you see the packages in AAPC, then you'll know. It's a free website. You can go and check it out, Mohsin. aapc.com. If you go to aapc.com, it will give you the details. And again, I'm telling you, don't get very taken aback कि बहुत सारा पैसा है, बहुत सारा इन्वेस्ट करना पड़ेगा मुझे. ऐसा मत सोचिए, क्योंकि ये इंटरनेशनल प्रोसेस है और यहाँ पे वो लोग डॉलर्स में ही वो खर्च करेंगे ना. उनका कंट्री का जो करेंसी है, उस करेंसी में ही हम वी हैव टू पे द फी, करेक्ट? सो दे वोंट कन्वर्ट इट इनटू रुपीस फॉर अस. हमारे लिए वो थोड़ी ना करेंगे. तो हम लोग इवन दो वी आर इन्वेस्टिंग, 2-3 महीने के अंदर जो कुछ भी आपने इन्वेस्ट किया है ट्रेनिंग के लिए और सर्टिफिकेशन के लिए, जो कुछ भी है, आपको आराम से 3-4 महीने में आपको वापस आ जाएगा. कोई प्रॉब्लम नहीं है. तो लाइक दैट यू हैव टू थिंक, राइट? सो आप सोच रहे होंगे कि बहुत सारा पैसा होगा, किधर से लाएंगे, क्या करेंगे, सब कुछ. सी, यू कैन गेट बैक योर मनी. वॉट एवर मनी यू हैव इन्वेस्टेड, इट विल कम बैक टू यू वेरी फास्ट विद इन अ मैटर ऑफ 2 to 3 months. Okay.
Ma'am, is there any age criteria or eligibility for that?
No age criteria. Anybody can take the exam. No age criteria. Anybody can take the exam. Yes.
That is, the payment is done according to the records that we do. Suppose if you do
Codes that we put. Codes.
Huh?
The payment is done as per the codes that we put.
How many codes that we put?
So based on the documentation.
Oh, suppose
These are technicals. We'll get into it later, Subhashini. Once you enroll yourself, technicals will get into this. Just a demo session, right?
Yes.
Technical aspects we'll get into it later. Almost, we are already late.